Carer Support Needs Assessment Tool, or CSNAT, has been designed to be used within a person-centred approach to carer assessment and support, which we refer to as the CSNAT approach. There are many definitions of person-centred care, so before we move on, we'll clarify what we mean by person-centredness. Person-centredness involves a collaborative approach between healthcare professionals, patients and carers. This means working in partnership with people rather than doing to them, and that healthcare professionals take a step back from being the expert. Many conversations between a carer and a healthcare professional happen on the doorstep at the end of a visit. This can feel rushed and isn't the best location when a carer needs to speak openly about things that might be bothering them. The NHS has used the House of Care model to illustrate person-centred care. The aim is to provide a holistic approach to care, helping people to achieve the best outcomes possible. All four parts of the house need to be present to achieve person-centred, coordinated care. First, the walls. At one side, they represent engaged, informed individuals and carers, and on the other, healthcare professionals working in partnership. Next, on the roof, are processes to deliver care and support based on the best evidence. Finally, commissioning of services and system improvements underpin the whole spectrum of care. The House of Care model and a person-centred approach to care sound great, don't they? But sometimes, in a busy practice setting, it's hard to see how all the parts of the House of Care work together. Or rather, if we lived in this house, how do we move around it? How do I get from this, plus this, to this? That's where the CSNAT approach helps. Our approach works by using a carer-centred assessment to create a link between engaged, informed individuals and carers and healthcare professionals working in partnership to enable delivery of person-centred, coordinated care. It helps practitioners and carers navigate their way around the House of Care in order to get the best person-centred, coordinated care possible. The CSNAT approach is a carer-centred process of assessment and support that is practitioner-facilitated but carer-led. By carer-led, we mean approaching the assessment as a facilitated conversation rather than a checklist. This allows the carer to reflect on their situation and say which areas they need more support with, what are the most pressing concerns for them, and what they feel would be supportive for them. Any support provided is therefore tailored to meet the carer's individual needs and driven by carers themselves through their suggestions. This is a process that may be repeated as the situation for the carer changes, and so will provide support at various points in the caregiving journey. The benefit of introducing the CSNAT to carers is that it provides visibility about areas of support that have been important to others in their situation. To coin a phrase, carers often don't know what they don't know. And by using the CSNAT to open conversations with carers, healthcare professionals engage with people when they don't know what to expect or to ask for. The CSNAT approach integrates a comprehensive, evidence-based assessment tool within a carer-centred process, which enables healthcare professionals to facilitate a truly person-centred approach to carer needs assessment and support. In using the CSNAT approach, we can move important conversations off the doorstep and give carers time and space to discuss their support needs and what they feel might help them.